audience, and thank you for giving me this chance to do this presentation. My name is Ashraf Al-Audi. I'm clinical manager from a facility company. The main purpose of my today presentation is actually to improve the practice and improve the outcomes of our machines and our therapy units. Okay, so I will try to do my best to give you as much information as possible, but I don't like to speak out of the focus of your focus, so I would prefer to hear from your side first about your experience with this VAC VeraFlow machine or VAC Ultra machine. What about the results you have achieved? What about the challenges, which is very important because my aim today is to overcome and to answer your questions. Okay, so would you like to start from your side? Just tell me about your experience with this machine before starting. Omar, maybe you can start.
Well, I've tried this machine a couple of times before. I still see it a little bit complicated compared to the old one.
Good.
So I hope I learned something new today.
Good. So I have a question for you. Have you used the standard VAC before?
Yes.
The InfoVac. Which one would you like to go for? The old one, the predecessor
Yeah,
machine?
I found it easier and straightforward for
Yeah.
troubleshooting and things like that.
Good. Actually, this is my job. When any company is introducing a new machine to the market, the company needs to answer the question why the customer should upgrade to this new solution. What can this new solution give you more compared to the predecessor solution? Okay, so this is my aim of my presentation today. I will start my presentation actually by two quotes of two professors. First quote is by Professor David Armstrong. He said that I haven't seen a wow healing like this since the original VAC therapy system. And second quote by Claire Porter. She said that I feel passionate about VeraFlow therapy. It is an evolutionary innovation. Why have good when you can have great? VeraFlow therapy has brought a magic sparkle back into the field for me and for my team. And then this is a surgeon's overview as well. And actually, VeraFlow, why should we upgrade to VeraFlow therapy? Because actually VeraFlow therapy will do three main actions for your patient's wound. Cleans your patient's wound, treat and heal your patient's wound. Actually, VeraFlow is the name of technology, while the VAC Ultra is the machine name. This first concept, VeraFlow, actually works via combination of negative pressure and solution installation to clean up the wound. So this concept was first prescribed by the Professor Fleischmann in 1998. His main objective was to reduce bacterial burden. So it was mainly for the very challenging, heavily infected wounds. However, the recent studies proved that even for the clean wounds, VeraFlow therapy will give you better results compared to the predecessor VAC machine. And again, that's why you should upgrade to VeraFlow therapy. Okay, actually, this is just brief history about the VAC machines. First VAC machine was introduced in 1995. This means a lot to us, and because you care about the outcomes, so you can hear, we have actually more than 23 years of experience with VAC therapy. You can count a lot on the safety and on the efficacy of VAC machine. And those are the different generations till we reach the most advanced machine, which is VAC Ultra. Okay, actually with VAC Ultra or VeraFlow technology, you have two options. You can use it only as VAC therapy, which means that you will use only negative pressure. You will not go for installation if you don't need to clean up the wound. Or you can go for VeraFlow therapy, which means that you will use both sides, negative pressure and solution installation. Actually, here we have something like the cruise control of your car. Actually, you can measure and control the negative pressure at the one side. Hello everybody, it's my pleasure to be with you today. Thank you very much for your time. Actually, my main objective of this presentation is to add value to your practice. My presentation will mainly focus on a new therapy unit of my company, which is VAC Ultra. And here I would like just to draw to your attention that do you know that every 20 seconds one patient loses his leg because of diabetic foot ulcer? Is it worth it to look for the greatest and the most effective solution for your patients? Actually, my presentation will not be monologue, it will be dialogue. I will tell you some information, but the most important for me is to get feedback from your side and also to make use of your practice, because I know many of you are very expert in the wound care field, and you will learn me a lot. I will tell you information and you will learn me a lot. Yeah, that's it.
Yes, not yet.
Okay, guys, so now it's the time for the same question. Is it worth it to upgrade from the standard VAC to VAC Ultra? The answer will be the summary of my presentation. Yes, it's worth it. You will achieve 44% more granulation tissue compared to the standard VAC. You will achieve 17% potential saving in patient treatment cost. You will achieve 98% wound closure rate. Okay, so now I do encourage you to start using VAC Ultra from today. Okay, it's worth it. Thank you. Yeah. Good morning, everybody. Hello.
Good morning.
Good morning.
Good morning.
It's my pleasure to be with you today. I would like to thank you very much for this chance you're giving me to present VAC Ultra, our most advanced therapy unit in the market regarding negative pressure wound therapy. I will just like to use a quote by Professor David Armstrong. He said that I haven't seen a wow healing like this since the original VAC therapy system. Okay, again he's comparing the VeraFlow therapy or VAC Ultra to the standard VAC. Here we need, and in my presentation, I need to illustrate and demonstrate for you why you should upgrade from standard VAC to VAC VeraFlow therapy. And I will also use one of the very important statistics that shows that each 20 seconds, one diabetic patient loses his leg because of diabetic foot ulcer. It's very alarming. Okay, my presentation time will be around 15 minutes. You are welcome to ask me all your questions after I finish my presentation. Okay, and I would like to add value to your daily practice, and in the meantime we will share experiences. I know that you are key opinion leaders in your field and in the surgery, so I may add to you some good information and valuable information. In the meantime, I will learn from your experience as well. Thank you.
Thank you.
Good afternoon. How are you, gentlemen?
Hi.
It's my pleasure to be with you today. I would like to thank you very much for this invitation to do this presentation, and I would like to thank you very much for your time. For me, my name is Ashraf Al-Awadi. I'm clinical manager for a Sality company. I'm covering Saudi Arabia region. Basically, I'm a pharmacist. I was graduated from Faculty of Pharmacy in 2002. So I have like 16 years of experience. I have got some postgraduate studies. I have got 1 year of study in clinical research from North Carolina University in the US. Also, I have got postgraduate diploma from Salford University, Manchester in the UK. And for my experience, I worked for 10 years in the sales for pharmaceutical companies and almost 6 years with a Sality company, specialized in the wound care field and the negative pressure wound therapy systems. So you can count on me. I have 6 years of experience. This presentation will be actually mutual exchange of experience and of knowledge. I will add to you some technical information and some good information, some updates about the VAC Ultra machine, which is actually this machine, the most advanced negative pressure wound therapy machine. In the meantime, I would learn a lot from your experience because, of course, you are leaders in the surgery field and in the wound care especially. Okay. My presentation will be around 7 to 8 minutes. It will be short and to the point. My presentation topic is VAC Ultra with VeraFlow technology, and my aim of this presentation again to demonstrate to you and answer a very, very logic question: why should you upgrade from the standard VAC to the VAC Ultra therapy? Okay. I would like to share with you also very important statistic improving that each 20 seconds one diabetic patient loses his leg because of diabetic foot ulcer. It's very alarming. Okay, and I will start by 2 quotes. First quote by Professor David Armstrong. He said that I haven't seen a wow healing like this since the original VAC therapy system. Again, our professor is comparing the standard VAC to the VAC Alta. Again, why should we upgrade? Is it worth it or not? Second quote by Claire Porter, lead nurse. She said that I haven't feel passionate like this. VeraFlow therapy is an evolutionary innovation. We have got when you can have great VeraFlow therapy is a magic sparkle back into the field of wound care for me and for my team. Okay. For the first prescription of the combination of negative pressure and instillation, it was first prescribed by Professor Fleischmann in 1998. His main objective was to reduce bacterial burden. Okay, so it was mainly for the highly challenging wounds. However, the recent research proved that even for the clean wound, you will achieve 44% more granulation tissue compared to the standard VAC. Okay, this is just small brief about the history of VAC machines. First machine was in 1995. It was called VAC Classic. This means a lot for us. 1995 means that we have 23 years of experience with VAC therapy. You can count a lot on the safety and on the efficacy of VAC therapy. And then it follows VAC ATS, InfoVac, VAC Install till we reaches and we have in our hands now the VAC Alta, the most advanced negative pressure wound therapy system ever. And now I'm gonna tell you a story. I'm gonna present to you a very impressive case. Let's see it. Please look at this wound. Okay, this is an old age patient, 72-year-old man. He's immunocompromised, actually cancer patient. It's very, very challenging wound. Actually, it is massive basal cell carcinoma resection. The start of the therapy was in 22nd of April. Okay, let's see how VAC Alta could help those patients. Before we go more further in my presentation and my slides, I have a question for you. Please, what about your expectations for this one if you will not use VAC Alta? So what about the time will be taken for this one to heal? And please consider that the patient immunocompromised and geriatric patient. Please.
It will take
Hold on.
ages. Yeah. 6
Patient might
months
die
maybe.
before it's even
Yeah. I totally agree with you. Yes. This patient most probably will die. So here it's to live or to die. And again, this is our portfolio logo and company logo is to restore people's lives. This is our story and this is how our story started, to restore people's lives. Okay, let's see how VAC Alta with VeraFlow therapy could save this patient's life. This is another review on the same day, 22nd of April, and then 24th of April, 28th of April, 2 views, and 1st May, again, 1st May, May 4th, and then May 6th. On May 6th, they discontinued VAC VeraFlow therapy and they switched it to the standard VAC because we achieved very, very good results and no need for the combination of negative pressure and instillation. Let's continue, May 11, May 19, another view, May 23. It's almost 19 days on VeraFlow therapy and 2 weeks on standard VAC therapy. Okay, then on May 26, split thickness skin graft. June 2, June 4, 30 days post-op. And this is the beginning and this is the end. I will ask you, is it worth it?
Yes, it is.
So I will summarize the benefits of VAC VeraFlow therapy. Number 1, you will save 17% potential saving in patient treatment cost. So generally, when we upgrade, we are expecting to pay more. But in this particular case, when using VeraFlow therapy, actually you will save costs. You will not pay more, okay? Number 2, you will achieve 44% more granulation tissue compared to the standard VAC. And number 3, you will achieve 98% wound closure rate regarding the complicated wounds, okay? So do you agree with me that it's worth it again? Okay. So I'm encouraging you starting from today to start using VeraFlow therapy and start to achieve even better results for your patients. Okay, thank you very much.
Thank you.